If you're trying to conceive and feeling overwhelmed with fertility advice, then this podcast is for you. Welcome to Don't Tell Me to Relax, your fertility podcast and antidote to unhelpful fertility information. I'm Hannah, a fertility acupuncturist, teacher and campaigner for better fertility education. This podcast aims to empower and inform you about your menstrual cycle and fertility. It's basically all that information you didn't get in sex ed at school, with the aim of improving your understanding of your reproductive health and optimizing your fertility. Hi everyone, and welcome to this week's episode of Don't Tell Me to Relax. I am joined this week by Trudy. Trudy, welcome.
Thank you very much. It's lovely to be back.
The ever experienced and widely knowledgeable Trudy, really here to talk about preparing for an IVF cycle and going through an IVF cycle, because Trudy, obviously you see lots and lots of people through cycles. How many in your time, how many people do you think you've seen through rounds of IVF? Do you have any idea of the numbers?
Oh, wow. I imagine that would be a fairly large number. It would be in the thousands, thousands quite easily.
You are well placed then to share your knowledge and experience, because you must have seen so many people go through IVF. And so from that, you must have a really good sense of the best or, good practice that really helps support people through the process. So kind of, before people get to do IVF itself, what would you say is like your best kind of suggestions to help people prepare before their cycle?
There's a few things that I would suggest, just again, over the years coming across the way that people's feelings can change during treatment. I often used to describe it as being a little bit like a hamster wheel, in that once you start down that fertility journey, it can sometimes be really difficult to know yourself, and as a couple, if you're coming through with somebody, when is your natural end point, or how much time and money, because it's a lot of people are doing this privately these days. The NHS funding is just becoming more and more difficult to access. At what point is it the stopping point? So I often say to people, before you even kind of come in to see your clinic, just sit down, have a really good discussion about, how many treatment cycles do you think you want to go through, to put your body through? Because these are not simple procedures. You often see in like articles, they're like, oh yes, you just do a few injections and then you come in and have an egg collection. And anybody who's been through an IVF cycle would tell you that's an absolute rubbish. It's a much more intense, much more difficult process, not just physically but emotionally. And to put yourself through round after round after round of that takes a toll. I think it's really important to have an open conversation beforehand about, what you guys can afford from a financial perspective, what you can afford, in inverted commas, from an emotional perspective, how you're going to support each other during the treatment cycle, because I think that has a huge impact on people's personal experience. Because if you're each coming at it from a slightly different angle, so to grossly generalize, male partners tend to be very much all about the practical. What do we do about the injection's done at this time and you take this tablet and then we'll come in on this point, and they tend to slightly separate themselves. Whereas women, I think, again, because it's physically happening to them for the vast majority of cases, they're the ones taking the hormones, having the invasive scans and procedures, the egg collection, all these hormonal up and downs. They tend to come from a much more emotional perspective, and you can see a lot of conflicts that occur within relationships where one person's trying to problem solve and the other person's just like, for heaven's sake, can you just give me some emotional support here? And it all becomes, really, really difficult trying. So I think that's another important one. The British Fertility Counselling Association, I throw them out every chance I get, because those are specially trained counsellors who are looking specifically at issues of fertility and family building. And they're a great resource to tap, even before you step foot in a fertility clinic or start treatment, so that you can sit down and have a discussion through some of these issues that maybe even you yourself aren't aware are issues yet.
So, Trudy, when people are going through their cycle, when they're actually doing their injections, what, in your experience, is the best thing that people can do to look after themselves as they're going through it? Because obviously, lots of people are very anxious about the injections themselves. But what I see is that most of the time people get into the swing of the injections, and it actually is much easier once they start than they had probably anticipated. So, what are the things that people can do for the injections and sort of generally to support themselves?
I think one thing would be definitely to try and make it as kind of stress-free as possible. And that looks different for everybody. So me, myself, I tend to be a very, very practical person. So for me, what would make me feel better would be I would create my own little calendar that would write down, every day what I need to do. And I would have like a running tally of what medication I have. So I would know exactly how much is left. I'd know what I'm doing. I'd tick it off or give myself a little star. That would be what would work for me personally. So other people may find that they would like to have a little ritual around their injections. So I knew a couple of people who would have these really lovely fancy chocolates that they'd buy themselves that they would only ever have as a treat. And every time they did their injection, it would be their little treat, was that they could pick one of these little chocolates to have. Everyone's kind of got their own personal way of dealing with this. There's nothing to say that if you're not sitting in the corner under a crystal on a full moon, that it's going to be a good or a bad thing. If you kind of catch my drift, there's no right or wrong way to do this properly, in inverted commas, because again, I get that a lot over the years, is how do I do this right? How do I do this properly? That looks different for everybody in a lot of ways. From a practical perspective, I would say just, planning out when your stimulation is coming out, try and avoid any major kind of events, work meetings or stresses as much as is physically possible. Obviously, we're all, busy working women and men. It's not always going to be that simple, but just try and minimize it. So if you're normally someone who's out every night visiting friends, maybe just have a little bit of a hiatus for a bit, just to allow yourself that time, so you can sit at home and spread your injections out in front of you and work out what you're doing, and you're not feeling under particular pressure. I can always remember one poor lass had a big work function at the Savoy, and she couldn't get out of it, so she'd had to smuggle. And again, this is back in the day when you had to do a lot of mixing of injections, and she's there on the toilet cistern in the Savoy bathroom at 9 o'clock at night trying to mix up an injection, just praying the syringe doesn't roll off underneath the door to her colleagues. It's just trying to kind of minimize those things as much as you can. Again, from a bit of a practical perspective, a lot of people become sort of, again, hyper fixated on things like the timing of the injections. And, if they say at 8 a.m. and 8 p.m., they're working themselves into a lather to make sure it's done exactly at 8 a.m. If it's done at 8:15 or 7:45 or 8:30, generally not going to make a huge problem. There's only one injection that is generally very specifically timed, and that's the trigger injection. And from a clinical perspective, we make a very big deal about that. We get you to repeat the time back to us. We tell you to set an alarm on your phone. We're being really, really hyper fixated ourselves on that particular one, because that's got to do with your maturation of the eggs and that final egg collection. But again, if it's 5 minutes late, that's not in the grand scheme, that's not a huge issue. If it's 5 hours late, that's a much bigger problem. But as a general rule, try and keep your injections roughly the same time each day and roughly spaced apart, to try and just keep the hormone levels as static as possible. Again, from practical perspectives, things like alcohol swabs. A lot of people think that you have to use alcohol swabs to cleanse the skin before a subcutaneous injection, which is the tissue into the fatty tissue. You don't need to. They removed that from the guidance, 10 or 15 years ago, I think, at least. If you want to use them, it's fine. It's not going to cause any harm or any problems. But the one thing I do say to people is make sure you wipe it off. So you've got that lovely wet alcohol on the skin. Just give a little wipe off with some cotton wool or a tissue, purely because wet alcohol, sharp object going through, you're going to drag it down to the nerves. It's a little bit like pouring lemon juice onto a paper cut. really going to be unpleasant. So just let the alcohol either dry naturally or wipe it off. The other one as well, I think, is people get a bit hesitant, and they can sometimes give themselves a little collection of pricks as they're going in. I often say, just, deep breath and just let your hand go down or your hand go forward. It'll go through the skin like hot butter generally, a knife through a hot knife through butter. So it'll go in nice and easily. And again, there's not a lot you can do wrong with subcutaneous injections. So you don't need to be concerned about doing the injection incorrectly and causing some kind of fatal mistake. You would have to really, really go some to injure yourself in a bad way with a subcutaneous injection. As long as you've mixed up the medication if you need to, or you've primed your pens and dialed it up correctly, and you've stuck it into fatty tissue, it's going to work absolutely fine. Tummy, leg, as long as there's wobbly bits, it's going to go absolutely no problems at all. So, to take a bit of pressure off people, don't worry too much about that aspect of the injections. As you're progressing through, a lot of people notice that their skin becomes a lot more sensitive, and that's a natural side effect of the elevated estrogen. People will find that hot feels hotter, cold feels colder. If they cut themselves, it feels more painful. Your skin feels sensitive, and that's again very common. Blood tests start to hurt more when you're having them, not just from the bruising from probably previous blood tests, but for the simple fact that your nerve endings are a little bit friable, so they're a little bit overactive at that point. So again, just being gentle with yourself, and paying attention to what your body's telling you. You might also find that you start to feel particularly tired during the stimulatory phase. It takes a surprising amount of effort from a physical perspective to grow all these little follicles. And even if you're only growing a few more than you normally would, it still takes a surprising amount of effort. So prioritizing sleep, making sure that you're hydrated. There's not a set amount of water that you would need to drink. There's lots of guidance around the place, but for someone who, let's say, for example, has a slightly more physically active job, will probably require more water than someone who's sitting in a nice air-conditioned office. You're looking at the color of your urine. Is it a nice pale yellow? Are you going to the toilet frequently? Those kind of things would be a good indicator. And again, a healthy, well-balanced diet. And by that we mean plenty of fruit and vegetables, legumes. You're not having too many takeaways, not too much high salt or trans fats, things like that. And I think we did kind of touch on it briefly before. If you are going to make any major dietary changes that your body may not be used to, try and do that a good few months before you actually get to your stimulation phase, because you want all those withdrawal symptoms to have hopefully abated and your body's used to this new eating pattern before you try and then throw a whole bunch of hormone fluctuation into the mix. Because if you try and withdraw all your caffeine, your sugar and your carbohydrates, and you throw a bunch of estrogen and progesterone on top, it generally doesn't make for a very happy outcome from you from a personal perspective. The eggs will still grow fine, but you're going to feel really rough.
So, absolutely.
So again, it's a good idea.
Do you think that people, there has been a lot more awareness around doing IVF fertility treatments in the workplace? So, you just sort of reminded me then when you were talking about the lady who was doing the injections in the toilet, because we still see quite a lot of people who still do that, who still secretly take their injections to work and don't want to discuss it with work, which is, it's everybody's choice. Do you get a sense of, is it, some people say, oh, I'd much rather be busy, it kind of keeps me occupied. Other people feel like, actually, I don't want to be working, but I've got to work. And other people like just take time off. Like, I guess I've answered the question myself. It's very personal, but do you, what do you see? What do you see is a good approach to work and how you juggle work and IVF at the same time?
I think a lot of it depends on your particular type of work. So, for example, someone who's primarily office-based and with meetings and things like that, it can be slightly easier to just shuffle things around a little bit So you can come to your appointments in the morning and then you can pop back in the afternoon. If, for example, you're a school teacher or a nurse, we do get plenty of other healthcare professionals from other areas that come in, or doctors, or, you know, you might work out physically on sites. It can be a lot more difficult for you to have that time to be able to come into your appointments. And often these appointments can be quite last minute because, again, the ovaries and the uterus and the sperm are the ones, you know, in charge of this entire thing. We're just waiting to see what happens. So sometimes we'll say, oh, we wanted to see you on Friday, but look, you've had a lot more growth than we were expecting. I think we need to see you on Thursday so we can keep a close eye on this. Or, you know, we need to increase your medication. Let's bump it out to this other day. So it can be really tricky if you're last minute trying to juggle around work and things. So I think that's, again, something to have a little think on, and whether or not you would feel comfortable going to your line manager or to your, you know, boss or whoever and saying, hey, I need some flexibility in the mornings over this time period for, you know, about 10 to 14 days. Is there any way that we can accommodate that? And again, I think it's going to be comfort level a lot of the time for people. Yeah. From a medical kind of perspective, there is no harm in continuing to work through the stimulation phase. We say definitely try not to do any work on the day of your egg collection, purely because most of the time you've had a pretty hefty dose of anesthesia, and it's not a great idea to be doing anything that involves too much brain work that day, because those drugs do take a while to kind of leave the system. And the next day things tend to be a little bit sore and swollen. So again, if you do want to go back to work, if you can do a, say, work from home day, or if you work a relatively sedentary job, you may feel more comfortable. But if your job is, say, a personal trainer, I would definitely recommend taking some time off, because that's not going to be an ideal one.
Yeah, lots of people say to us, doing IVF is like having another full-time job.
Oh, absolutely. 100%. 100%. Yeah.
So when it comes to egg collection, what are your kind of tips for preparing for egg collection and going through egg collection and the recovery from egg collection? Because I guess for lots of people, if it's their first time, there's a lot of intrepidation at that point of the cycle. So what do you advise to people at that point?
So I always think it's a good idea to have a bit of an understanding before you turn up on the morning of what's the procedure going to look like at this particular clinic. Because the actual collection procedure for the vast majority is the same every single clinic I've worked at. What will change slightly is the degree of anesthesia that you're given when you're expected to come in to be admitted into the procedure room, how long you need to fast for, because very few places would not require you to at least to have stopped eating and drinking for a certain period of time beforehand, purely from a safety kind of measure. How long are you expected to stay there? Does somebody need to take you home? Or do you want somebody to kind of come and be a support person while you're there? So speaking to the way the Eve Oil has it currently set up, we generally have people not eating or drinking from around midnight the night before, and that's a practical thing to do with the safety of having you sedated. So we want to keep you under a nice deep sedation so that, you know, you get the little cannula in the back of the hand, all the good drugs go in, and the next thing you know, someone's trying to give you a cup of tea and a biscuit afterwards. That's how we like to do it. But if you have, for example, eaten or drunk and your tummy's full, there's a risk of you aspirating the contents of your stomach into your lungs if you're sedated. So they would have a much more shallow sedation for those kind of people. And vast majority of people would tolerate that really, really well. But I always think, look, put yourself on the best possible footing to keep everything as comfortable and pain-free as possible when you're coming into an egg collection procedure. You might be given a little suppository to take beforehand, which is a long-acting smooth muscle relaxant, which is really good, because what often happens after an egg collection is we've collected all the eggs, the body's kind of detected that something foreign is going on. So the uterus starts to cramp down, going, well, I don't know what's happening, but I'm going to get rid of it. And it'll just start cramping. And for some people, especially if you've got additional issues like adenomyosis, endometriosis, fibroids, etc., that can be quite a few levels jumped up from people who don't have those particular medical conditions. So we tend to give a nice smooth muscle relaxant so everything's a little bit calm, and it should stay that way for at least 12 to 18 hours afterwards. So we'll give you instructions on those kind of things. Just something nice and comfy to wear. You know, the tracksuit pants and a nice big shirt. You don't want anything too tight or constricting around your tummy for afterwards, because it will be a little bit sore and swollen, and will increasingly become so after a couple of days. We do recommend, and I think the Royal College of Anaesthetists also recommend, that any type of sedation procedures that you have somebody to take you home. You might feel 100% fine, but your blood pressure may disagree 20 minutes out of the procedure room, and you don't want to be trying to navigate the tube system with low blood pressure that may cause you to faint. You may become nauseated or need to vomit, etc. So you kind of want someone around who could just keep a little bit of an eye on you and help you to get home safely, and make sure you're all set up on the couch with a nice box set and some goodies to treat yourself for the afternoon while you have a bit of a sleep and recover from that one. But generally, pain afterwards will kick in around the 72-hour mark, because at that point, the ovaries that have been drained have all pretty much puffed back up with fluid. So they're pretty much at their pre-collection size. Often the lovely medication that we give you to help keep you nice and sedated has a beautiful constipating effect, which is always really pleasant when you've got a nice swollen set of ovaries and a very swollen uterus at the same time. So everything tends to get quite swollen and sore and crampy in the tummy region. So it'll peak after about 3 days, and then it should start to feel better after that, especially as your kind of natural period comes on, if you're not going straight for embryo transfer. But if you are going straight for embryo transfer, increase that fluid and fibre intake. That's going to go a long way.
That's what we always say. If somebody is then going, let's say they're doing a fresh transfer, so they've had egg collection, they have day 5 embryos, and they're going to do a transfer, what are your top tips for transfer day? It's kind of a big day, transfer day. What do you say to people?
It is. If you can have the support of your partner there, definitely. It's, I think, always helpful to have that second person. Don't worry too much about standing up and moving around after embryo transfer. It is the first question without fail I get every single time, is if I stand up, will it fall out? No, 100% no. When we see our anatomy pictures in the textbooks, it looks like the uterus is basically an upturned vase with a hollow core, and it's not. If you can imagine a jam sandwich, and each side of the uterus is the 2 bits of the sandwich, and you've got the jam in the middle, which is your endometrium, and we're sliding that embryo in and putting it directly into the endometrial cavity, and it's sticky. Blastocysts especially are very, very sticky, which is why they always flush the catheter to check and make sure that they left the catheter, because sometimes that stickiness can actually cause them just to adhere to the side. So we think we've done an embryo transfer, but when we have a look at the catheter afterwards, there's a little embryo still clinging on in there, and generally you've just got to then flush it out, load it up into another one, and pop them back. So they're kind of designed to stay in there. So when you stand up, it won't just fall out as though it's an upturned vessel. The other thing as well to remember is that when you are kind of standing up and walking around, the natural state of the uterus is actually to either be flopped over forward like a little pouch, or if you've got a retroverted uterus, it's flopped backwards. So again, it's not like the pictures where it's standing up on end. So it naturally forms that kind of a pouch. Similarly, sneezing, going over bumps in the road, sitting down heavily on a chair, lifting a toddler, etc. That's not going to cause any issues as far as the actual embryo integrity and where it's sitting in the uterus goes to. If you're putting back a day 5, like a blastocyst embryo, generally implantation will occur within about 24 hours. So after that point, it's either worked or it hasn't, and we're just waiting for those serum blood levels to kind of come up from there. We say to avoid things like, heavy aerobic exercise. And by that, we mean spin classes, running of marathons. I wouldn't be sitting in a sauna or a hot tub, anything like lifting so much weight that it's like properly straining you. If you're just moving the washing around the place, absolutely fine. Although if you do want an excuse for your male partner to do a bit of housework, then of course, definitely no housework whatsoever. I have told quite a few ladies over the years to be like, it's fine, you can tell them that.
Yeah, I think that's a good one. That's a good one.
Absolutely.
Doctor's orders.
Totally. There's got to be some advantages to this really stressful
Yeah.
process. But yeah, so it's, again, the distraction, because once that embryo goes back, I think at that point, again, every sneeze, every cough, every twinge, every time you go to the toilet, you're going to be, again, hyper focused in on every symptom, and then you'll start Googling it. Please do stay away from Google. I usually tell people, like, if you can, just uninstall it. Don't have it as an option. Just step away from the Google, because there's all kinds of crazy and really unhelpful things out there that are just going to make you more and more anxious. So I often say, if this is the time to get that busy work out, start doing a puzzle, start reorganizing your paperwork, all those things you've avoided doing that will just kind of keep your mind minimally occupied, that you can potter away on, head to do that kind of stuff. Go back to work. If you've got just a job where you're pottering about in an office, or going from place to place, absolutely fine, no problems at all. They did a study, oh God, many years ago now. It's probably horribly outdated that I'm quoting it, but they did a basic kind of comparative between people who had been laying down continuously after embryo transfer for a minimum period of 24, 48 hours, 2 weeks kind of thing, to people who just got up and went about life as normal after an embryo transfer. And they found the higher rates of success and the lower miscarriage in the people who just got up and got on with life. I think there's a view that you need to be kind of laying down with your legs in the air for 2 weeks, because any kind of movement could jolt it, and that doesn't seem to hold up at all, from the research that's been done. So yeah.
And so that once embryo transfer has been done, I guess you are then in what people often say to us is like the worst bit of the cycle. People, I think before someone's ever done a round, they think the worst bit is going to be in the injections. But actually what they say on reflection is the worst bit is the 2-week wait, because then you're into that zone where it's like the dead zone, where you are not, there's nothing you can do. You don't go for any appointments, you don't have check-ins, you kind of nothing. There's your progesterone suppositories or injections if you're taking them, but in terms of like the check-ins, that before you were going for scans to see how everything's developing, it's kind of like there's not really a lot that's happening, and I think people say that's the hardest time. So if you've got any pearls of wisdom to share with people about what they can possibly do during that time.
Yeah, that is the absolute worst time. And as you very rightly point out, when people first come in, they're worried about the injections and the egg collection. When they've had one round, it's the 2-week wait. And it's absolute torture, because as you say, there's nothing any of us can do really. We're just sitting back and waiting and seeing what's going on. And it's a torturous time period. I'd love to be able to give kind of secret signs or symptoms that mean it has worked or it hasn't worked, to be able to give you early on. But unfortunately, I have seen all kinds of signs and symptoms for people where it has worked and it hasn't worked. And it's almost indistinguishable early pregnancy symptoms from your period coming on. Even to the point where some people will get kind of those first signs of what we think is our period starting. So they'll get that brownish spotting, but that can actually be a sign that it has worked. It can be a sign that it hasn't worked. So it's super, super unhelpful. So this is where I tend to really push the distraction theory, just whatever gets you out of your head, and thinking about something else for as much as you can. Again, that support from a partner in a way that is supportive to you. And I think that's something that is important to verbalize at the beginning, just to say, hey, I'm going to go through this really super stressful thing. I would like cups of decaf tea, and I want to sit down and watch the entire box set of Downton Abbey, and you're going to sit there with me with popcorn, and that's how you're going to support me. I think that is probably more useful. Or similarly, again, if you're coming through as a single woman, or whatever, and you're having other people who are being that support person for you, just say, hey, when I give you the signal, this is what I'm going to need. keep me away from the internet, keep me distracted. I want to go and go on a riverboat cruise and go and sit and take that backwards and forwards to Greenwich or something. Just whatever kind of keeps you from obsessing and constantly sitting there very anxiously. Because again, I think when things don't work, the very first thing nearly every single woman I've ever come across in my many years of doing this has gone, what have I done wrong?
Yeah.
And the answer is nothing.
Yeah.
Absolutely nothing.
Yeah.
We cannot control these things. We love to think we have control about these things, and we can, as long as we're eating a healthy diet, we're not, throwing ourselves out of airplanes, or running an ultra marathon, or getting thrown through the front windshield of a car, etc. If you've slipped up and had a naughty treat one night, or you went over a big bump in the car, or you slipped down a couple of steps, that's not what has caused something to work or not work. But yeah, I think as women, we do love to throw the blame directly onto ourselves as quickly as possible.
Absolutely. And it's such an important point, isn't it, to remember and sort of reiterate. And as you say, once the embryo, it's out of our control. And people come to our clinic, obviously, as acupuncturists. And I always say acupuncture is not, we cannot make this be successful or not, that, because I think people often associate, if I do acupuncture, if I do meditation, if I do yoga, if I do all these things, it's going to be the thing that's going to make it work. I'm like, that's not what we can help you feel relaxed. And we might be able to help your digestion in that point of time, and we can be there to support you. But, nobody can ever say ever that they have any control over this at all, because it's, you put that embryo back and it either works or it doesn't, and nothing that we can do it's kind of already sort of decided, I guess. Your clinic has got the medication and all the medication's doing the thing. And I wish there was something that was so sort of concrete that this would definitely be a thing, but it can't, it isn't like that.
No, and it would be wonderful if it was. I remember back in the early days, again, when they first started associating acupuncture as a really good example with higher chances of success. And I saw this lass who was probably mid-cycle, and you've just never seen a more stressed out. She was actually vibrating. And she was like, I've got to go. I've got my acupuncture session. And I was like, oh, that's interesting that you're doing that, because she had the most horrendous fear of needles I've come across. It took almost 2 of us. It got to the point where she nearly had to be held down in order to be able to have the blood taken. And she was like, I can't control this reaction. She's like, I know it's ridiculous, but I can't stop it. Like you just need to do this to me. So, and I was like, okay. So I'm like, well, how are you finding the acupuncture? And she's just, gritting her teeth and bearing it for the entire way through. And I'm like, have you considered maybe acupressure massages instead? Because I think, whilst there does seem to be some really interesting research coming out, if it's correspondingly making you so stressed and you're having just this huge physiological reaction to it, I think that's going to outweigh any good that may be coming from the actual process itself. Because a lot of the women would be like, oh, my lovely like my lovely acupuncture thing. I go, nice little dark room and just get to lay there and no one's bothering me and my phone's off, and I get a whole hour where I just have this wonderful, relaxing experience. And I think that's has a huge kind of, as you say, a huge influence on how well the body kind of takes to these things. If you have a massive fear of needles, don't do it. It's a bit like I've had some ladies with the intralipid. A lot of people see the research around that and go, oh, that's for me. And I'm like, but you have a really severe soy allergy. So if we tried to put this in your body, you're going to probably have some kind of anaphylactic reaction. But I think they narrow down and go, but it says that it will help. And I'm like, yes, but that's really not going to help. Again, if you're putting your body through this kind of massive physiological event, that's not going to help.
Absolutely. And I think there was the thing about acupuncture was that Paulus study, I think I'm saying it right, that was the German study where people were having acupuncture before and after transfer. And that, I think that became the thing that made it so sort of popular alongside IVF. But then they did studies afterwards where it showed a detriment, because what happened was, exactly as you say, people were stressing getting to their acupuncture appointment, getting to their IVF transfer, getting back to their acupuncture, and it's just too much. And so we always say to people, it has to work for you. You have to feel better. And if you don't, then please don't do it, because that's not what we're here for. And I guess it's also a bit like the symptom spotting in the 2-week wait. There is, just as there is no one thing that's going to make that transfer be successful or not, there is no one sign that you're going to be able to pick up on that will say this has worked. And wouldn't it be amazing if, like, your right ear went yellow or something, and you just knew, wouldn't it? But it's so cruel, exactly like you say, that the symptoms of your period about to start and the symptoms of pre-pregnancy are like the same. It's like a cruel mistress where you don't know which one it is.
Yeah, absolutely. And it's a form of psychological torture. I'm convinced of it. Because I cannot imagine, especially doing it just the once, I think would be difficult enough. But if you're on transfer 3 or 4 or 5, I think one lady I'd met had over the course of her kind of reproductive life 24 transfers.
Oh my gosh.
And all I could think of was, how on earth have you had the mental strength to keep doing that? I just absolutely blew me away. I could not imagine putting myself through that many times, because it is so difficult. And that 2-week wait is it is really awful. For everybody involved, I think, because we find it from a clinical perspective, we find it really difficult, because we do become incredibly invested in our patients' success, because we tend to see people from when they come through the door, and we get involved in their stories. Like, I've come across instances here where the entire nursing department has burst into tears because they found out someone who's had a really tough time of it has had a successful pregnancy. And similarly, where someone has, had a miscarriage, very tragically, we've had to do a lot of debriefing and counselling sessions with our staff, because they find it really, really difficult, because that's why we kind of came into this area. And what keeps a lot of us here is the fact that we do have that personal relationship with our patients, that we do become really invested in people's treatment and outcomes.
Yeah, absolutely. I hear you there. So just to kind of recap, Trudy, if somebody is, maybe they're listening to this and they're preparing for their first cycle, what would be like your 3 top tips, kind of overarching all of this, at each different stage of the cycle? What would be your 3 are there 3 main takeaways you could give that person?
I would say probably the first one would be that sitting down and getting your support in place, and whether that's that chat with the counsellor, the chat with your partner, the chat with your friends or family members, get yourself a little support team in advance, and have a really good think yourself, what works for me. Don't become invested in what the latest Instagrammer is saying or what this book says you should do, within reason. If you hate the idea of meditating, don't do it. Find something up, do a jigsaw, read a magazine, paint your nails, whatever works. So just kind of get that idea in place, and forward thinking, try and just make sure that you've kind of cleared the runway, so that you can focus as much as you can on that. Then you've got your diet and your adjuvant, we call it adjuvant or alternative therapies that are going along with it. So if you do feel that you would benefit from a diet or lifestyle change, get that started sooner rather than later. Get that really nicely bedded in. And then the third thing I would say is practice as much as possible, anticipating that things are going to be different and things are going to change. You need to almost kind of go with the flow of your cycle. I think we want to have that really idea of, this is when I start, this is when I will finish, this is how it will look at each and every point. And if I don't achieve that, something catastrophic has gone wrong. It hasn't. Your body will do what it's going to do, and we're going to support it and kind of go along with it. But that may mean that you're doing some changes at the last minute. Your medication may change, your appointments may change, your blood tests may change. But just try to, as much as possible, accept that that's an inevitability with IVF. If you're having a treatment cycle where no one is adjusting what is happening based on what they're seeing on that screen, that's a massive red flag to my mind. If they're just powering ahead saying, well, this is what we'd planned at the beginning, but no one's adjusting based on your personal response, that's a worry, because they're just running roughshod over what's happening, and more than likely you're not going to get a great outcome from something like that. So just get into that mindset of like, you know what, I don't know exactly, this is roughly what's going to happen, but we don't know. We just don't know. My ovaries are in charge during this phase, so we're just going to go with what they're saying to us, because those two little ovaries definitely rule all of our lives during that phase.
Oh, thank you so much, Trudy. That is so helpful. There's so much practical information in there, and I think you're so right. Like thinking ahead, planning ahead, getting your support in place. The anticipation of the positive and negative, and sort of bracing yourself and creating the space is really, really good advice and information. So thank you for your time today and bearing with us. We have had some kind of technical gremlin in our machines today. So thank you for bearing with that. It's lovely to see you as always. And I will put all your details on the show notes as always. So thanks, everybody. Thank you, Trudy.
Thank you so much. It was lovely to speak to you again.
And we look forward to the next episode. And thanks for joining us today. If you would like to leave us a review, then please do so. We really appreciate it. Thanks till next week. Bye. If you've enjoyed listening to this and want to find out more, then come and join my free community in Facebook. We have loads of resources. You can catch up on all our previous webinars and be the first to know about forthcoming events. To sign up, just follow the link in the show notes. And if you'd like to work one-to-one with myself or one of the team, then please see our website, hannahpern.com, where you can book in directly or organise a discovery call to find out how we can support your fertility and your reproductive health.